of the community present here. And thank you for Steve, always being a very supportive friend for Muslim community in general and also UMMC in particular. I would be very interested in obviously Steve telling us what is the status and what may be the some of the delay or bottleneck in the process, because I remember we UMMC had a webinar with the Maryland Health Department on 9th of January. And we were very excited because obviously Maryland Health Department and their outreach person, Mark, was very excited that the communities are reaching themselves to Maryland Health Department as a sign of, collaboration and participation, because as you know, the general notion out there is that the healthcare disparities that we see always in healthcare is now coming into the vaccination world as well. And a lot of people were and still are afraid that the marginalized communities, community of colors and others, maybe will be behind in getting vaccination. So obviously Maryland Health Department was very excited to see that a Muslim coalition or Muslim organizations themselves coming forward and saying, how can we collaborate for us to be a bridge to our community to get anything, first of all, making them aware that it's important to get it, but also, get it. But I would say that I'm disappointed myself, and I would, speak on behalf of the community. What feedback I have is that there is a significant delay. Obviously, healthcare workers, including myself, got the vaccination. But when it comes to the community, the 75 and above, and then there was a date for 65 and above, and that didn't happen. And even, people from 75 and above, some of them had problems. And also community is asking that, okay, this is fair that 75 and above and 65 and above, but what about a person who's 72 or 62 with a lot of comorbidities, and how we factor them in to getting the. So I think to answer, instead of nitpicking, I think the main thing is if we can expedite the process, and if we know, Steve, where is the bottleneck, and if in any way we can help as the community leaders to not only for us, for Muslim community, but any communities in Maryland, I'd be happy to participate in any effort and collaboration that will ease the burden on governor's office or Maryland Health Department to reach out to the community, because the community is also asking, the Maryland being the richest, one of the richest state in the country, how could we fall behind? And Governor has been so proactive and very successful in combating so many different challenges. And this is yet another challenge. So I would be, curious to see where are the issues. I think that'll be it for me. And I'll be listening and interested.
Thank you so much, Dr. Shahid. I think we'll go ahead and segue over to handing the mic off to Steve, Mr. McAdams, and he can incorporate maybe some of the questions that you had about vaccine supply and distribution administration into his portion. So for those who aren't familiar.
Absolutely. So first, Doctor, congratulations on heading UMMC. It's a great organization, and over the last 6 years, we've had an excellent working relationship, and we hope to continue that and build on what we have done to date. Second, thank you very much for everybody's leadership and willingness to participate and message to the community on behalf of what's going on with the infrastructure and where we are now and where we expect to be over the coming weeks. But first, I just want to give you a snapshot of where we are in terms of COVID-19 and where we are in terms of number of cases and hospitalizations and the death rates. Currently, we are in the third, we're coming out, we're on the tail end of the third wave of COVID-19. And right now, our numbers are about 30% off of their highs from where they were at the beginning of January. Currently, hospital bed counts are down 95 to 1,282. Confirmed, deaths were unfortunately 33 yesterday. The percentage positive, which the benchmark that the federal government set early on was 5%. We are at 5.32% right now. Back in January, we were up at a high of just over 9%. And to date, Maryland has done and administered over 7,300,000 COVID-19 tests. And that's, as we look at the vaccine distribution, that's a very important number to keep in mind, because if you recall, this time last March and April, the states and the hospitals were receiving maybe about 10 or 20 test kits to start. And now we're at the point where we could do almost 100,000 tests in a given weekend, with distribution points all over the state where anybody can walk in pretty much any pharmacy or medical center and be able to get a test. And you're going to find that the vaccines are also going to follow kind of the same process, because as we move forward week over week, month over month, the manufacturing is going to mature. Additional suppliers are going to come online, and you're just going to see exponential growth. So to date, as of this morning, Maryland has administered 752,036 total doses, with 74% of those vaccines being first doses. So we are currently doing, on a 7-day rolling average, 25,558 vaccines as of this morning, where we're at. So just to give you a little overview of what's going on in the overlay that we're in, the structure that we're dealing with as a state, is basically there were two manufacturers, that drug suppliers, that came out with the vaccine that was approved in December, and they were Moderna and Pfizer. And both of those require a 2-shot process. So they didn't have a massive supply built up and pre-manufactured. And the federal government, from the Trump administration to the Biden administration, the whole desire was to get the vaccines out and administered as soon as they were being produced. So when you have a typical product like this that would get approved, you would probably most likely be looking at a launch date 1 year later or 10 months later, because they have to build up the inventory, they have to build out the supply chain, and then they have to get it out there and they have to launch. In this case, vaccines, we need the vaccines in arms last March. So we really don't have the luxury of waiting until the fall when it's readily available and you can just get it out in every location, in everybody's neighborhood or pharmacy. So with that overlay, the state of Maryland is receiving 1.74% of the total doses that are being administered in the United States on a weekly basis from the federal government. So we originally started out with receiving a couple thousand doses 7 weeks ago, to the point now where this week we received 88,000 doses. And those doses are first doses. At the time of the state being notified what the Fed is going to distribute to us, they also allocate the second dose, which the Fed will be shipping to all the providers that received it approximately 2 to 3 weeks later, which will be depending on the time frame for when the second dose is to be administered. So we are receiving the doses in the early stages, the best way with the limited number of supply to get to government workers like health, like paramedics, firefighters, government officials, people who are on the front line, healthcare workers, was to administer that. The infrastructure was in place where the health departments could work with the county and Baltimore City Health Department, where they could directly be able to administer their own workforce, as well as they would have oversight with the hospitals, and they would have oversight with the most vulnerable, which would be 75 and older. Those points were natural settings because when you administer the vaccine, depending on where it is and what facility, if it's not in a hospital, it's pretty much a mini medical center that's being set up, and they have to do it where they have security there. They have very detailed records on who's getting the shot. They double and triple check you. They provide it. Then after you provide it, they have medical professionals, nurses that will watch you for 15 minutes. There's paramedics on site. And then when you leave, you're given a card that states where you received it, the vaccine, and when approximately you get your next dose, and you have to bring that card back. So what's happening is as we move forward, right now we're at 88,000 doses that we're receiving. We'll find out tonight, how many doses we'll be receiving next week. At the beginning of this week, the federal government told us, hey, you're going to receive 88,000 at minimum for the next 3 weeks. What the goal is, as the supply chain matures and as they can produce more, they can get it out more to the states. So the anticipation from the federal government and all of the drug manufacturers who are manufacturing, and with the additional 2 additional drugs that are going to come on, one from Johnson & Johnson, which they already have submitted and it's in. They have already made, and they have on hand 100 million doses that as soon as they get approved, that will be those will be out and in the market in real time. So at these stages, what is happening is we are anticipating, and the federal government and every state's pushing and doing the same thing, to continue to build out the infrastructure. So hospitals have been at it. Some of the drugstores have been at it. The federal government is going to be moving towards supplying CVS, Walgreens, 2 national chains. There's 40,000 locations. As they get mass vaccines coming in, they're going to start shifting, and they're going to start sending them to the pharmacies, so that you'll be able to go there. And in addition, we're standing up Safeways, we're standing up super centers, we're working with Rite Aid to do mobile command centers where we can go out to the field, like churches or schools where you may have some hard to reach communities. But as far as the bottleneck that you're talking about, it comes down to one simple thing, and that is there's not enough supply. And the manufacturers cannot make them quick enough. You basically right now have you have the 2 suppliers, and you have worldwide demand. The state cannot go and buy the vaccines directly from either one of those. They can only come from the government, federal government. So we are very concerned, as are every county executive and the mayor of Baltimore, to make sure that there's equitable and as rapid distribution as you can. And the goal here is that there's 6 million people in Maryland, and with the current phase that we're in, 1A, 1B, and 1C, there's 2 million people who are eligible for the vaccine. And currently in this first group, we realize there's going to be 2 different phases. There's going to be the phase where executing and getting the doses which are being produced right now to the people who are knocking on the door and want the vaccine right away. And in the foreseeable future, probably in about 3 months, you're going to see that there's more doses available than there are people willing to take the dose. And so we're working on the second campaign in order to be able to go to the communities that are not trusting. They don't have confidence in the vaccine, or they're underserved and they may not have the access to be able to get there. But Governor Hogan is 100% committed to being the chief advocate for the state with the federal government, and he's always going to ask and demand for more than what's being allotted to us. And we do have, as of today, we have over 2,000 distribution points that are ready to go as soon as we get, as soon as the vaccine starts to be delivered in greater quantities. And again, nobody from the federal government to anybody in the state of Maryland or any county executive is holding these doses. The doses are shipped directly from the manufacturer right to whoever's administering the vaccines. And we currently have 100% of the doses that are allocated to us committed to our providers in order to get them out. So I hope, tonight I hope I can give you a little bit of an overlay of what's going on, where we're going, and in turn that will allow you to share that with your community and also make plans as you head into the spring and into the summer for your events and programming and everything else. So thank you.
Can I make a comment and ask a question?
Yes, sir.
Okay. The comment is that it seems to me that there is no organized manner, at least in the state of Maryland, to administer or allocate the vaccines to in each group. And it has to be on the computer at a very specific time in order to be able to get in line. That's a comment. And the question is, why has CAIR been given a priority in terms of administering the vaccine to their patients above other groups?
Great comment. And second part is a great question. So the first question, as far as there is no organization and that groups aren't, you don't know when you're going to get the vaccine. Is that what you're saying?
That's what I'm saying, because I myself, I'm almost 80 years old, and I signed up for the vaccine weeks ago, and neither my wife nor I have been able to get it, despite the fact that we've gone online at any hour of the day and at nights also. And on the other hand, there are some people, I don't know them personally, but I understand that they have been able to get the vaccine. So there doesn't appear to be any order in which the people in a particular group will get the vaccine. That's the comment.
Yeah, so excellent comment. And let's just take Montgomery County, for example. They have 74,000 people who have registered for 1A, and the county health department was receiving 5,000 doses a week. So at that rate, it will take them 7-8 weeks or more. What was that? 75. So 12 weeks in order to go through it. But here's what everybody, somewhat of the misconception is: when your group is eligible, that doesn't mean that you're going to be able to sign up right away and be able to get your vaccine. And the only reason why is because the supply is not there yet. But what's going to happen week over week, there's going to continue to be more vaccines delivered to the state. And you're going to see the amount of people on the waiting list being given the shot is going to greatly improve, and it's going to expedite as we move forward. The second part,
excuse me, but that applies to the county. But if you look at Holy Cross, or you look at Giants, or you look at Safeway stores, and you go online to try to get a vaccine there, by the time you even click on it, it says, sorry, we have no more space. So you're not even in line at that time.
Right. So this is what's going to happen. All of the Safeways and the Giants, they're all receiving a minimal number of doses, like 200. And the reason why they're getting a minimal amount of doses is because they have to be able to do a test run, a beta run, to make sure that they can handle and they can record and they have a process in place, a test process. So right now, when they're getting their 200 folks, if they're standing up, they're receiving those folks from the people who are currently waiting online through the county. They're working with them and they're providing them those groups. So as we move forward, the importance of having all these additional providers is that a month from now or 2 weeks from now, we could have 100 million doses that are distributed amongst the United States, and we could be allocated 1 million doses. And we have to be ready to be able to administer those as soon as we get those and they're ready to go out. So part of it is we're not going to stay at the same pace of vaccines that we're getting on a weekly basis. They continue to grow. And as they continue to grow, the goal is to get as many people vaccinated as quickly as possible.
I may have missed, did you mention a timeline for when you're expecting the supply to ramp up of doses?
Yeah, I think you'll see a significant ramp up over the next 4 to 6 weeks is what's anticipated.
And there have been several mosques that have expressed interest in possibly serving as administration sites. And I know, Dr. Samir, you and I spoke about this recently about the logistics involved with that. Is that something you can speak to briefly in terms of, like, from the governor's perspective? Is that something that you would be encouraging houses of worship to help facilitate doses, administration of doses to their own congregations, to the broader community, or is that not necessarily something that's helpful?
Keeping in mind that some of them have medical facilities at their thing, so clinics.
Yeah, so yes, I will. But first, I'd like to answer his question in regards to Kaiser Permanente. Kaiser Permanente was selected because of their high percentage of Medicaid patients, as well as the large percentage of their folks who they insure are of the hard to reach communities and ethnic diversity. So that's why they were selected because of their ability to get there. And on a weekly basis, the Kaiser locations are receiving about 700 doses. So it's in proportion to what everybody else is getting. Now, this is where we're at right now. And the reason why the state is having to build out and stand up additional infrastructure is because under the Trump administration, their philosophy was, we're going to send it to the states and you guys build up distribution. Under President Biden, they're kind of up in the air as to which way they're going to go. Send it all to the states, or are they going to use the federal pharmacy program and push them out that way? And also, are they going to send up major FEMA sites with the National Guard and FEMA? So those answers are going to be answered over the next coming weeks, and we'll know which way to go. So the first phase, if it does fall mostly on the states, the state will, once we get to the point of getting the outlets that we have signed up right now, once we get them up and going, we will review the data and we'll see which communities are participating and which areas are having a low participation rate. And then at that point, we will be standing up mobile centers where we will work with faith-based facilities or local schools or community centers that we can go in and address that. So I'll give you an example. Currently in Prince George's County, they are one of the top in the state in terms of receiving total number of doses because of population. But yet with the minority community, they have about a third of participation rate as you do in other areas of the state that are receiving smaller amounts of doses due to population. So we are working with the county executive and the health department there to try and figure out how we can message what we can do in order to reach those communities. And as we move forward and we get some more data available, my prediction when it gets to that point is probably going to be later in the cycle, like maybe in the summertime, where we'll know, we'll have good data as to know where we need to go and what we need to do, and if you can stand up, you know, a center where we give 700 or 800 shots.
Can I ask a question?
Yes, sir.
Dr. Ashraf Sufi, I am a retired gastroenterologist. I represent MCC. There's one comment and one question. I think the way I think we started distributing or the age group, even the people who are 75 and over, which is 1B and 1A, they were not even completed when 1B started. And 1B is still not finished, then we already have 1C. That really makes very confusing. My wife is 76 and she has still not gotten. She's a physician also, but retired. She doesn't work even though I work as a charity physician. So I think that was something, if it could have been more organized. We know that from this date to this date, we are only going to get 1C people, and then we will expect that to do that. So that was my comment. The question comes also is why did I understand, and please let me know if I'm wrong, that the hospitals and the inpatient hospitals and all that, they got directly either from the state or from the federal government, and then the county got through and other outpatient clinics and everything got it through the state. And I have heard, I used to practice in Montgomery General Hospital, MedStar Montgomery General Hospital in Olney, and I have a lot of colleagues there, and they said there were quite a few vaccines which were not being used. They were wasted. And many of the volunteers who worked there, because they have the approach there, they just went there and then said, you know, okay, they told them, okay, you come after about, 4 o'clock or 5 o'clock. If there is some saved vaccine, we'll give it to you. And so that was my concern. Is that right or is that wrong? And the third question was about how do the state decides how much vaccine Montgomery County gets and how many vaccine the other counties do. These are some of my questions. And thank you for taking our questions.
Yes, sir. Let me see if I can recall 3 questions, but the one as far as hospitals and there were shots that vaccines that may not have been administered and were sitting around. Those are all reasons why both the Trump administration and the Biden were pushing on all the governors to go into 1A, 1B, and C, as well as Governor Hogan received a letter from all 8 county executives of the Central Maryland, which represent 84% of the population, specifically asking that we allow them to go 1A, B, and C, because in some cases, in some hospitals, I think some of the administrators were surprised that some people were unwilling to take the vaccine, and they didn't have authority to add into an additional group in order to get the vaccines administered in a very quick manner, if you will. So all those factors played into it. In addition to opening it up to 1B and 1C, also had to do with reaching more people in the ethnic community, because in in the 1A group, it was a higher percentage of non-minorities than it was minorities. And there was also concern amongst a lot of the county leaders at trying to reach a lot of the a larger percentage of people in the 1A, if they weren't in a congregate setting, it was difficult to be able to get people in and get them the vaccine and back out. So it's all part of, it was a myriad of reasons why they did that. And, with the ultimate goal of, the vaccine is going to increase week over week, and they want to make sure that they can effectively receive them and get them administered so that the federal government will keep giving us additional supply and not cut back on our supply.
Along those same lines.
I'm sorry, Brother Sheikh. In the interest of time, we're going to actually ask you to stack. If you'd like to comment, if you could please post in the comment section. I believe Sister Adila commented that she wanted to go next, just to make sure that everybody has an opportunity to speak in the limited time that we have. I apologize, I didn't mean to cut you off. But if you,
Okay, no problem. If somebody else wants to speak, I'll wait.
And if we could please,
everybody, we just need to keep in mind that, like the other programs that the federal government rushed out in a rush, back with the PBE program or back with the unemployment program. I mean, look at unemployment. When they passed the stimulus to add that, they added a whole bunch of groups that weren't covered before. And so in real time, it got passed, and then it's sent over to Department of Labor, and the Department of Labor has to try and write software and rules for all the new people, which then they have to send to the states, and we have to have our software guys write it, and the two systems have to tie into each other. And then as you get going, they realize that they didn't do some stuff right. So then 2 weeks later, they have to rewrite it, and then we have to rewrite it, and that drops people out. So given the context that we're under and the amount of pain and stress that's going on in real time, and the need to not get it perfect or give the agencies time to build out, they want to get it in. They want to get it distributed as quickly as possible, even before in some cases they've had time to build out the software system like unemployment. And because of that, you're going through a lot of growing pains because they're not having the 6 or 8 months to go through and test it and build it and beta test it and get the providers up and going. So the goal here is to get reach mass herd immunity as quickly as possible, which will be most likely in the summertime, and to get started now. And along the way, there will be some growing pains, and it's important that we hear your feedback so that we can do our best to try and address that.
Thank you so much for that, Steve. Sister Adila, if you'd please take the floor. It's yours.
Yes. Thank you so much, Steve, for spending your time with us today and taking our questions. I had a comment and a suggestion for something for you to think about. As some of the other leaders mentioned, as faith community, we have access to a lot of the people, just like you mentioned that you picked CAIR because they had access to a certain demographic that you're trying to reach. The faith community, I'm from ICM, Islamic Center of Maryland in Gaithersburg. We're actually being a food access provider all through COVID, like some of the other mosques as well. So we're working very closely with the food task force and providing food to seniors, not only our own seniors, Muslim seniors, but to everybody, which means we have their trust, we have their information, they're coming to us for food. A lot of the people that are reaching out to us don't know these Hunger Games of go to this website, go to that website. This is how you register. Some of us educated people do, some of us with kids and other people do, but some of the other people are reaching out to their food access providers who give them the food to kind of say, what do I do next? So I understand we have a shortage of supply at this point, but whether you decide to use the food access providers as vaccine centers or not, you should consider them as allies so we can reach out to that community where you say, okay, now we have Six Flags open. Do you want to bring a bus full of 100 people? And we'll fill it up with seniors and bring those people because we have access to those people. Thank you.
No, well, thank you. That's something that we absolutely will look to and work with you on. And, again, I also like to just frame this again. We have a two-phase process here. The first phase is that we have probably 1.5 million people knocking on the door, wanting to drive wherever they need to drive to in order to get their vaccine at a point in the stage where the infrastructure is still being built out and the vaccine supply is in the infancy stages of where it's at, and that will grow. So once we get to the point where all those who want to be vaccinated have been vaccinated, the next campaign will be reaching all the communities that are hesitant or don't want to do it, or get into groups that aren't in a congregate setting where we can work with you in order to stand one up so that we can have them come there. So we absolutely will be looking to work with you on that. And my anticipation is that we'll be coming in the second stage once we address everybody who is ready to rush to us to get the vaccine, and then we move to the next phase where it'll be more going to folks who need help or need better access points in order to receive it.
Okay.
Dr. Torrey, I believe we have you next in stack.
Okay. So again, thank you, Steve. Thank you for taking this time. I just had first to follow up on what Sister Adila just said. Just to quickly list some of the assets that the Muslim communities offer that could be a source of help. And then I just wanted to make a few comments to make sure that a little bit off the vaccine topic, but still related, that would affect all of the communities as well. So first, there's a high percentage of health professionals in the Muslim community. So that can afford a lot of assistance that way. Also, in addition to having access to seniors by the food distribution I mentioned, we also have our close relationships with all the other community organizations in and around each mosque and school, and we also have Black, Latino, and immigrant community within our communities. Although this panel may not reflect that, it actually is a very significant portion of our population. So we are an asset in that regard in reaching them. Also, a couple of us have clinics associated with our institutions. And then if there are ever any need for cultural sensitivity, translation services, anything like that, where we have an amazing body of talent in our communities that can be a source of support. And religious institutions, I realize, the whole separation of church and state, but now we're talking about servicing communities at a time of a pandemic. They're in a unique position. We're in a unique position to serve the population with message, with different touch points, and with increased trust. So now, as far as a couple of requests, if you will, one is with regards to schools. There will be a lot of efforts mentioned, that will come forth with servicing the public school system. I would like to request that the governor's office put the same amount of emphasis on teachers that teach in private schools, Muslim schools, Catholic schools, Jewish schools, etc., that they too have they're afforded the same access to services and programs as the public schools. That goes with vaccines, with tests, and with grants, any grants afforded, school related activity. And then the other would be with mental health and social services. Professionally, I work in a large health system in Maryland. Well, actually, I'm wearing it, so I guess I can say it, MedStar Health. I'm not speaking on behalf of MedStar Health, but I serve as something called Care for the Caregiver, where I help the front line deal with the stress that they're going through. And I'll tell you, I'm seeing the same signs and symptoms in the frontline healthcare workers as I am in the community. And so mental health resources and tying them in with the spiritual and other services related at the houses of worship, I would say, if there are any efforts made in that, please realize that everyone on this call is an asset and has deep need in those areas. So grants and any ability to help service the communities in that way. So I would just appreciate it. And again, thank you for your time. And I will mute.
Thank you, Dr. Torrey. And we have gotten a lot of complaints where private school teachers were turned away from getting vaccines over public school. And the health secretary has made it clear, and the federal government makes it clear that you cannot turn somebody away based on whether they're private or, if they're not in a category, that's one thing, but you cannot. And all the county executives said that they won't do that. And they made it clear to their health officers as we go forward. Mental health, absolutely. We do, the lieutenant governor has been working on mental health, and we see it increasing. We see mental health issues and the scope of it increasing across the state, and we're very much aware of it, and I will keep you abreast if there are any type of grants or programs that do come out. And the government is very much supportive of the private school system as he is the public school, and we will do whatever we can to make sure that there's equitable treatment in both groups.
Thank you, Steve. Sister Farida Zaberi, I think you're on track. Okay.
Thank you very much, Steve, providing all the detailed information. And I represent ICCL Islamic Community Center of Laurel, and we are doing, since COVID has started, many social work like providing grocery and cooked food, and also we with the Laurel. ICCL is the emergency supply center also. If it's in case of any disaster, the county use the ICCL space, and we will be helping them. So I was thinking about that vaccine, and if we could do that too. And then we all talking about the vaccine availability and when it will be supplying and all those things. No one is talking about, not in anywhere, about the safety of these vaccines, because you can read so much literature against these vaccines and side effects. I think we need to also, government and the professionals need to talk about the safety of these vaccines. So the public or community who is hesitant to take, and by the time when the vaccines are available, then it would be easy for them. And the other thing is, I live in Howard County. So Johns Hopkins, they keep sending an email saying now you are in the category 1C. My mother also lives with us. So you are now is age limit since Biden came in, it started from 65 to 80 or something. So they are in touch, but they also said we don't have the vaccine yet. So we will have supply, we will let you know. So I think it's other hospitals and health centers are contacting their patients, So my main thing is, I think we need to talk about the safety also and side effects. And what about the Johnson & Johnson vaccines? No one is talking about those vaccines. Are those available also or not?
They submitted either Friday or Monday, or I think it was Friday last week. And, it's widely expected that they'll get approval here, if not before the end of this week into next week. And once they do get approved, they already have 100 million doses that are made and ready to go. And also, just say like with Pfizer, Pfizer came out on Monday and they said that they are able to reduce their production time from 110 days to 60 days now. So their ability to ramp up is also coming. But as far as the safety and the effectiveness of the vaccines, we have started, Governor Hogan started Go Vax campaign, where we have literature and campaigns, social media icons that will point them to the CDC and studies that took place and what went into it, so people can readily anybody who has a question can really have that information available to them so that they can study it and determine if it's for them. And we will also be looking to leverage with you as we move into the next phase to use the GoVax and the social media to help use people in your community who are influencers to share and share the message about the importance of vaccinating and where you can get it and everything else. And we'll share with you those media imprints that you can use as well to help message to your community. But you can count on us coming back to you. Both the Secretary of Health, Dennis Schrader, has been to many of the mosques and knows many of the leaders around the state, and we're very aware of the talent within the community, especially in the medical field, and the willingness for volunteers in all the facilities that you have and what you're willing to provide. The question that we have right now that everybody's waiting to get some direction on is which direction is President Biden's team going to go? Are they going to direct it all themselves directly at the pharmacies and urgent care centers? Or are they going to deliver it to the states and say, states, you go and stand up all these centers and facilities and recruit all these physicians or medical professionals to help do mass vaccination sites. So as we get a little more clarity as we move forward here, and my guess is we'll probably have clarity next week, we'll know better as to what we can do and what we can plan, and what route they're going to be going. But I can promise you that your specific community will be one of the first ones that we reach out to because of all the strengths that you offer in those areas. So we appreciate the offer, and we will be calling you as soon as we have a direction, and we know when we're going to be getting the vaccines and where we can go.
One more question. You think in the future we will have option to select which vaccines we wanted, which makers?
I do. I think that this time next year, if you already haven't had your vaccine, you could probably call around and figure out which one you want and go get it. So just like the test kits, it's just a matter of time before it ramps up. And at first, you won't have that choice. You either have a choice: do you want to get your vaccine at this time at this location? And if you don't like which drug, because they only get one shipped to them, they don't get multiple ones, then you would have to back out and go back in the queue for another location.
Thank you.
Thank you for that question, Sister Farida. I think Sister Yasmin, we have you in stack next. Assalamu alaikum.
To everyone, and good evening. Steve, thank you for speaking to the community across Maryland tonight. I am with the Muslim Family Center in Howard County. I am a pharmacist by profession, so I do work with the FDA, and also I moonlight with CVS. So I'm actually actively giving COVID vaccinations right now. So I'm really invested in the process and trying to help serve the community as well. Of course, I'm not speaking on behalf of either one of my employers tonight.
So you see it's a very detailed process?
Get to see all sides of it. So I definitely understand the challenges that the state government is experiencing with supply and distribution. Being on the other side and administering them and seeing what goes into getting it from the pharmacy all the way into an arm. You do understand that it's not such a simple procedure. So I really appreciate the efforts that are taking place. So my question is kind of more about the supply. When, like you mentioned, Johnson & Johnson is, with the FDA, we're expecting hopefully by the end of the month that it will get the authorization for emergency use. Does the state have any plan to perhaps use that vaccine versus Moderna and Pfizer in the bigger community-wide clinics? Because when we talk about vaccine hesitancy in immigrant communities or minority communities, If you take out the compliance piece of needing them to come back for that second dose, it might perhaps get more success in getting more people vaccinated. So is there any thought about using that one versus another in these more large scale community clinics? And the second part of my question is, as the supply does ramp up, when you expect this option to join kind of the armory that we have, will the state be then conducting more open clinics that won't be requiring registration? We'll have it'll be an open clinic. There's so many thousand doses available that day and people can just show up. Because I know there's been a lot of challenges, especially like in, 1B, 1C, more elderly community members who are really struggling with the online appointment process. At what point does the state envision that we will have open walk-up clinics available to our communities? And that's all on me. Thank you.
Two excellent questions, and let's talk about which vaccine is selected or chosen. We don't have that choice. The federal government tells us, we put in requests saying, hey, we need from all our providers, we need X amount of vaccines for the upcoming week, and then they'll respond back to us several days later and say, okay, we're giving you X amount, but they don't tell us which ones or what they are, and they just ship them. They ship them directly from the manufacturer, the drug maker, to the pharmacy company, right to the distributor, wherever they're being administered, right there. So they won't know really what they're getting until they're told, hey, this is what's coming, and this is what you can expect. And as far as what was the second part of the question about ramping up? Oh, about registering.
That will really get to kind of more open clinics,
right,
where we're not really dealing with the whole registration issue.
So that's an interesting question, and I can tell you right now, with the point that we're in right now, the main concern with so few people being vaccinated and where the COVID numbers are, they don't want people congregating, especially if they're at risk folks, where it could be spread while they're waiting in a 2 or 3 hour line. So, and then the other part of that too is from the medical records, as far as getting reported into the system, making sure that you have everybody's right information. Because when you go and you receive your vaccine, every distribution point that I've been in, it's been a very deep, they have all your records, they know who you are, they double check, it goes into the internet system so that there's a record of who you have. So it's a very detailed process, and I don't know if 5 or 6 months from now, if you're got 50 or 60% of the people and coronavirus numbers are extremely low, then it may be a safer point because you're not processing as many people at once. But at the early stages, I don't see that happening right now. But we do want to make it easy as possible to as we move deeper into the higher percentage of the community getting vaccinated. The deeper we go, the harder it's going to be to reach those who are hesitant or have logistic problems getting there. So there could be further concessions made at that time to try and figure out how to do that. But at this stage, it's too early to say. And Zainab, I'm not. I'm fine. I have time. So if you want to keep going, I don't want anybody to feel rushed.
Be careful what you ask for, Steve. We might keep you here until midnight.
Sorry. It's important. It's important that everybody has a good understanding of where we're at, because the lack of the misunderstanding or the confusion that's in the community just makes people's anxiety levels go even further. And what everybody does need to know is that everybody who wants a vaccine will receive one. It's just going to take a little bit of time. And in the scope of things, it's really not that much time. It might be 3 months, 4 months, 2.5 months, but it's coming, and it's coming as quickly as it can logistically be done.
Thank you so much for that question, Yasmin. Next, I think Dr. Samir, we have you in Stack. If anybody else has questions, please feel free to post them in the Stack so we can make sure we don't miss anybody.
I had two points, I guess. One's a question, one's a point. I just thought it's important to, I think, take into account, you've said a couple of times that people that want vaccines are going to go first, and the people that are hesitant and those sorts of things are going to be, we're going to circle back to them later. But, you know, I think that, and I understand why that is, but I also understand that if you do it that way, a lot of the vaccine hesitancy is stratified socioeconomically. So I think that we, by doing that, it increases healthcare disparity to groups that maybe are underprivileged already. So you know, I think it's important to do outreach to those communities up front, not just wait till everyone else is vaccinated, then go back to them. I think it's really important that those communities get educated and get encouraged to do it, because you know, there's no reason to increase the already huge healthcare disparity there is with this virus across our communities. The second thing is one of the topics that is in the title and was schools. And resumption of schools. We have a lot of teachers in our community, and we have a lot of educators in general. We also have a lot of families with kids. So there's a lot of concern about the school situation. And I know a lot of teachers have expressed, not just in our community, but all across the board, a lot of concern about the fact that it is unlikely that they will be vaccinated before they start school. And there hasn't really been, the teachers that I know have not really seen any type of program to try to get them to the front of the line to get vaccinated, or at least somewhere. You know, vaccines been opened up to several different groups, and we've talked about already how people are having trouble getting appointments and how they get booked up quickly. But most teachers I know aren't aware of any special program to get teachers done. And at this point, there's no way they're going to get vaccinated before March 1st. So what is and the governor really kind of mandated that schools start on March 1st. So, I think this has created a lot of concern, a lot of fear actually among our teachers and in the families too. So maybe you can address those issues.
Sure. So I apologize if the context of, hey, we're really going to deal with underserved communities after everybody who wants, we bang down our door to get one gets one. We're very concerned about equity, and the Department of Health meets weekly to review all the numbers, not only internally with the State Department of Health, but with all the county departments of health, so that we can assess the numbers, which is why we're opening up these additional sites for convenience in neighborhoods, so people can get there at the drugstores and the grocery stores. And specifically with Prince George's County and Baltimore City, we stood up and we're building out the ability for our first 2 mass distribution centers at Six Flags and at the Baltimore Convention Center, specifically because the data is coming back that the community is participating at a lower rate than other communities around the state. So we are very concerned with that. We started a work group which has over 100 community members back in November, specifically engaged towards messaging and what we can do to reach those communities. Fortunately, we already had somewhat of that infrastructure in place from just going through the census tract and reaching the hard to reach communities there. So it's very much a concern. We very much are doing everything we can to try and do it. And we will either allocate more money to the county executives for messaging in order to get more people out, or provide more sites for the locations around the state, especially in the minority communities that have a very low percentage, but also have a very high percentage of having COVID.
Education's a key part of that, though. I think education needs to
Yep, and that's so we'll send you the go backs with all the education points and talking points and what we're doing to reach all the communities, so that you'll be able to see that and be able to share that data as well. And as far as the schools go, there's there's overwhelming evidence and stories of the effects children are having by staying at home. Some children are fine. They have great support structure at home. They're in a very healthy environment, and other children are falling behind very quickly. And there's a lot of mental issues that they're experiencing because of the lack of interaction and being in a setting where they can interact with others. We do know, and the data from the school systems, not all school systems in the state have been closed. The school systems around the state that have been open and teachers have been teaching in classes, there has not been a spike in coronavirus amongst the teachers or the students, as well as the school systems around the country. However, the governor, as well as all the county executives and health officers, know that they want to do everything they can to get more vaccines to teachers and health workers and everybody else. And as we receive a greater supply, a greater number of that supply will be provided to them. In addition, any parent who is uncomfortable with sending their children to school, they also have the option to continue with the remote learning.
Teachers don't have an option. They have to go in. I mean, even if they're uncomfortable with it, they don't have any option. They have to teach, and they have to go in. So that, and they weren't really given a good opportunity to get vaccinated. So that's a problem.
Steve, on that note, there were several people who wondered about the timeline. How did the governor make the decision to reopen schools by March 1st? Or how did he come about with that date? Was it specific data he looked at, or what was the process for that?
Yeah, so the school superintendent, Karen Sandman, has been monitoring the school systems that are open around the state. And they've been watching the infection rate and if there was an adverse effect with having the schools, and there wasn't. So based on that information, based on the vaccines on the point of coming out, and based on all of the adverse effects that we're hearing from around the state and legislatures of the effects it's having on the children within their districts, they felt that it was time to give those the option that wanted to go back to school, the ability to go back to school.
Thank you for answering that. Brother Ayman Nasser, I have you next in stack. If you'd like to ask yourself, or I can read it aloud for you.
Assalamu alaikum. Sure, either way is fine. Thank you, Steve, for your time. I guess there was some hesitation from many people to go take their vaccines, given the delays that happened in Arundel with the second dosage of the vaccination. So what do you see is the status with the second dose for those vaccines?
It shouldn't be a concern. As soon as we're, for this week, if we're told we're receiving 88,000 doses for this upcoming week, they've already placed 88,000 doses for second doses that will be delivered on average about a couple weeks later. The issue that happened last week, it happened with a technical error with Department of Health, U.S. Department of Health, and Maryland Department of Health. And they attributed that mostly to the change of administrations. But from the time our Secretary of Health found out about it, which was on a Saturday, they had it resolved on Tuesday, and nobody missed the second dose.
Okay. Thank you.
So keep in mind that everything is being distributed as it's produced. And there could be a glitch along the way where, if a provider received 5,000 doses and they're supposed to get 5,000 second doses, there's a possibility they could receive 4,800 and receive another 200 a week later. But it should, and that's why they try and get there 2 weeks after the first shot, so there's enough time for them to receive it and then schedule it. So there could be some minor hiccups here and there just based on logistics. and the number of vaccines that are distributed across the country. But overall, it's going to be a very small percentage, and it shouldn't be at a point where anybody would be at risk.
Okay.
Sister Thesnova, we've got you down next.
Okay, thank you. So I actually just had a question about whether or not the state would be providing or giving funding for PPE for teachers and staff at the public schools.
The state of Maryland, through our Maryland, we have, so there's the Federal Emergency Management Agency, FEMA, which is the national one, US. And then Maryland has Maryland Emergency Management Agency. And then each one of the counties in Baltimore City have their own emergency management in there. So if you have any school systems that, or hospitals that, or assisted living or nursing homes that are short of PPE and can't purchase them, what happens is the local county emergency center will make a request to Maryland, and we will ship them. We have a 3-month supply in warehouses, and we're ready to assist if needed, as well as providing for the state workforce. If you are working in a school system where there's problems receiving it, just let me know, and I'll make a call to our Maryland Emergency Management System, and they will coordinate with the school.
And for like any COVID testing or contact tracing, would that be through the Maryland Department of Health or through the separate Board of Education? How is that going to be?
So currently there's 1,500 contract tracers across the state, and they're all overseen by the county health department or Baltimore City Health Department, and they manage their own counties.
Okay.
I think that that's the last question. There's a few other comments. I think Sister Farida, the links that Brother Samir is going to share with you will answer some of the questions that you have. If nobody else has any further questions, I'd like to thank you for your time, Steve, and I'd like to thank all of the leaders for their time for joining us for this conversation. And on the point about opening up, vaccination administration sites at faith-based centers around the state, if you have any guidance, Steve, on what the next steps for that would be, whether you're taking the names and contact information of the institutions that are interested in wanting to potentially participate in such a program, maybe some of the leaders here, especially those who have medical centers affiliated with them, like MCC and ISB, might want to connect with you separately offline so that you can keep those conversations going, offline as well.
No, and especially if you have within a community, if you also have a higher group of people in 1A or 1B, or children with developmental disabilities or that, it would be very good to let us know, because both the Department of Aging and Department of Disabilities is working with Department of Health trying to stand up centers where groups aren't in, congregate centers where they're easy, where we can go and we know they're there. So if you have specific groups at this early stage, we would definitely love to talk to you about that and work with both Department of Aging and Disabilities to help stand those up at this early stage.
On that note, would we be able to share your contact information, maybe your email address in the chat group? So if any of the leaders need to contact you separately offline, they would know how to reach you.
Yeah.
Okay.
Please provide my email and phone number.
Great. Thank you so much.
Can I make a quick comment, Sister?
Sure.
I just wanted to just follow up on what you said. So the webinar we talked about a couple of times there, ICM and the Voices, the Muslim Voices Coalition and the MCC sponsored this webinar with Dr. Uzma Sayed, who's a nationally known infectious disease physician. She's been on, on national TV networks and CNN and things, and she's really well known. And we happened to have a contact with her, and we got her on. So she did a webinar that was very good and it was geared to the Muslim community. So we've posted it, ICM has posted it. I think Sister Sasnuva was really instrumental in facilitating getting the speaker, and they've got it posted. So if you need to find that, you can go to YouTube, and the MCC channel is MCCMD, or you can email me at president@mccmd.org. It's in the chat, and I can help you find it if you want to watch it. She gave a lot of basic information about the vaccines and about the safety and about the testing and what an RNA vaccine is and things like this. And I think she did a very nice job. So that's available to our community.
Thank you for sharing that, Dr. Jaffrey. And I know Sister Adila and I both shared earlier, tomorrow, inshallah, American Muslims for Health Professionals is going to be hosting a webinar with Dr. Fauci on COVID vaccinations and all things related to COVID. So please make sure that you share that with your communities. Encourage folks to tune in. There's going to be a lot of really helpful information that's relevant to Muslim communities specifically with Ramadan coming up. And I know Ramadan didn't come up in this conversation too much, but if any of the mosque leaders specifically have questions about logistics pertaining to mosque operations during COVID, whether there's going to be any restrictions or anything like that, please feel free to reach out to Steve offline, or if you want to take the floor and ask the questions now, feel free to do so, inshallah.
Sister, what time is that, that webinar with Dr. Fauci? What time?
Sister Adila, could you share the link for that again? I don't have it pulled up. I shared it earlier, but I don't remember off the top of my head. I think it's in the evening time, but I don't know exactly when.
1:30 tomorrow.
It's afternoon. I'm sorry, 1:30.
1:30, I thought it's 11:30 to 12:30.
Sister Adila will share the link shortly, and we'll hopefully have that pulled up soon.
I just pulled it up to confirm. It does say 1:30 Eastern time on the link.
Great, thank you, Yasmin. Does anybody have questions about Ramadan specifically, about operations for your mosques?
Well, Ramadan, I was talking to my, BOD and council, suggesting. I mean, we didn't make any decision yet. Like we do the Friday prayer in the parking lot, and I thought, if we cannot do it inside, it's risky. So maybe we should continue in the parking lot for like 125 limit. And so we could find out some logistic and how we want to do it and all those things, but we didn't talk much about it yet.
Steve, do you have an idea on whether there's going to be limitations or restrictions on capacity for houses of worship by mid-spring or so in late March, early April?
Right now, it's at 50%.
50%.
So statewide, it's 50%, and any county can restrict that further, any jurisdiction. But right now, the state's at 50%. And as our numbers improve, and as we get as a percentage of the number of Marylanders get vaccinated, I'm sure you're going to start seeing things open up more. Right now, But I hope I provided everybody some basic overview of what's going on. And right now, it's currently just a simple supply and demand problem. And as soon as supply ramps up, we have the infrastructure to meet the demand. It's just a matter of waiting and trying to have a fair process in place, equitable process, and a rapid process to try and get the vaccines that we receive administered as quickly as possible, so that we continue to receive more from the federal government. We don't get our supply cut and sent somewhere else.
No, yeah, this has been really helpful. Steve, thank you so much for your time again. I want to just reiterate, we went over the hour that I promised you. So really appreciate you always being so patient and helpful with your information. Please convey our regards to the governor as well for all the efforts from the state level in terms of just managing this chaotic period. And I think to reiterate what Dr. Torrey said earlier, if there's anything that Muslim leaders here can do, we are very well connected. We have a lot of resources, a lot of talent, potential ability to really sort of tap into those communities where we are not otherwise able to connect with when it comes to these kind of situations. So please leverage these relationships and these resources to really sort of address this pandemic in a more cohesive way if it's useful for you and your office.
Great, thank you. And just just please make sure that everybody messages to the community that everybody who wants a vaccine will get one. It's just going to take a little bit of time and be patient, but they will get one, and hopefully we'll be in good shape by the beginning of summer.
Sister Thasnuma, did you have your hand raised earlier? Was that you, or did I?
Yeah, I just wanted to know, so can you again mention if there are, for example, mosques or businesses that want to help with the vaccine initiative? Is it the Office of Community Initiatives that they would need to contact, or is there any other agency?
There is, well, what I'll do is I will email Zainab the website link where you can go on and register. And then I also ask that you take my email address and notify me. That way I can speak directly to the health team that's standing them up and let them know, so it doesn't go in, one of 1,000 sites that are coming in. I can do it. So there is a website for that. I'll send that to Zainab and she can distribute it. And if you do have a facility, want to do it, please also email me so that I can make sure that gets raised to the top.
Great. Thank you so much, Jazakumullah khair. Thank you again, Steve.
Sister Zainab, thank you.
Thank you
for organizing this.
Thank you.
for having us. Yes.
Like
Thank you.
Good night.
Thank you.
Doctor,
Thank you.
thank you.
Take care,
Nice
Steve.
one.
Bye.